Text 1. Schizophrenia. Definition. Schizophrenia is the most chronic and disabling of the severe mental disorders, associated with abnormalities of brain structure and function, disorganized speech and behavior, delusions, and hallucinations. It is sometimes called a psychotic disorder or a psychosis. Description. People diagnosed with schizophrenia do not always have the same set of symptoms. In addition, a given patient's symptoms may change over time. Since the 19th century, doctors have recognized different subtypes of the disorder, but no single classification system has gained universal acceptance. Some psychiatrists prefer to speak of schizophrenia as a group or family of disorders, the schizophrenias, rather than as a single entity. A standard professional reference. The Diagnostic and Statistical Manual of Mental Disorders, also known as the DSM-IVTR, acknowledges that its present classification of subtypes is not fully satisfactory for either clinical or research purposes, and states that alternative subtyping schemes are being actively investigated. The symptoms of schizophrenia can appear at any time after age 6 or 7. Although onset during adolescence and early adult life is the most common pattern. There are a few case studies in the medical literature of schizophrenia in children younger than 5. But they are extremely rare. Schizophrenia that appears after age 45 is considered late-onset schizophrenia. About 1 to 2% of cases are diagnosed in patients over 80. The onset of symptoms in schizophrenia may be either abrupt, sudden, or insidious, gradual. Often, however, it goes undetected for about 2 to 3 years after the onset of diagnosable symptoms. Because the symptoms occur in the context of a previous history of cognitive and behavioral problems. The patient may have had panic attacks, social phobia, or substance abuse problems, any of which can complicate the process of diagnosis. In most cases, however, the patient's first psychotic episode is preceded by a prodromal, warning, phase, with a variety of behaviors that may include angry outbursts, withdrawal from social activities, loss of attention to personal hygiene and grooming, anhedonia, loss of one's capacity for enjoyment, and other unusual behaviors. The psychotic episode itself is typically characterized by delusions, which are false but strongly held beliefs that result from the patient's inability to separate real from unreal events, and hallucinations, which are disturbances of sense perception. Hallucinations can affect any of the senses, although the most common form of hallucination in schizophrenia is auditory, hearing voices. Autobiographical accounts by people who have recovered from schizophrenia indicate that these hallucinations are experienced as frightening and confusing. Patients often find it difficult to concentrate on work, studies, or formally pleasurable activities because of the constant, static, or buzz of hallucinated voices. There is no typical pattern or course of the disorder following the first acute episode. The patient may never have a second psychotic episode. Others have occasional episodes over the course of their lives but can lead fairly normal lives otherwise. About 70% of patients diagnosed with schizophrenia have a second psychotic breakdown within 5 to 7 years after the first one. Some patients remain chronically ill. Of these, some remain at a fairly stable level while others grow steadily worse and become severely disabled. About 20% of patients with schizophrenia recover the full level of functioning that they had before the onset of the disorder, according to NIMH statistics. But the remaining 80% have problems reintegrating into mainstream society. These patients are often underachievers in school and in the workplace. and they usually have difficulty forming healthy relationships with others. The majority, 60 to 70%, of patients with schizophrenia do not marry or have children. And most have very few friends or social contacts. The impact of these social difficulties as well as the stress caused by the symptoms themselves is reflected in the high suicide rate among patients with schizophrenia. About 10% commit suicide within the first 10 years after the diagnosis, a rate 20 times higher than that of the general population. Subtypes of schizophrenia. DSM-IVTR specifies 5 subtypes of schizophrenia. Paranoid type. The central feature of this subtype is the presence of auditory hallucinations or delusions alongside relatively unaffected mood and cognitive functions. The patient's delusions usually involve persecution, grandiosity, or both. About a third of patients diagnosed with schizophrenia in the United States belong to this subtype. Disorganized type. The core features of this subtype include disorganized speech, disorganized behavior, and flat or inappropriate affect. The person may lose the ability to perform most activities of daily living and may also make faces or display other oddities of behavior. This type of schizophrenia was formerly called hebephrenic, derived from the Greek word for puberty, because some of the patient's behaviors resemble adolescent silliness. Catatonic type. Catatonia refers to disturbances of movement, whether remaining motionless for long periods of time or excessive and purposeless movement. The absence of movement may take the form of catalepsy, which is a condition in which the patient's body has a kind of waxy flexibility and can be repositioned by others, or negativism. A form of postural rigidity in which the patient resists being moved by others. A catatonic patient may assume bizarre postures or imitate the movements of other people. Undifferentiated type. Patients in this subtype have some of the characteristic symptoms of schizophrenia but do not meet the full criteria for the paranoid, disorganized, or catatonic subtypes. Residual type. Patients in this category have had at least one psychotic episode, continue to have some negative symptoms of schizophrenia, but do not have current psychotic symptoms. Cultural variables. There appear to be some differences across cultures in the symptoms associated with schizophrenia. The catatonic subtype appears to be more common in non-Western countries than in Europe or North America. Other studies indicate that persons diagnosed with schizophrenia in developing countries have a more acute onset of the disorder but better outcomes than patients in the developed countries. The Gale Encyclopedia of Mental Disorders, ed. Ellen Thackeray, 2002, pp. 845, 846.